Hey guys, it's Dr. Chris here, and I want to explain to you today how our country can spend 5 times as much money on healthcare as the next closest country, and yet we rank 37th in the world for overall health. I mean, most people would have a hard time naming 36 other countries, and that means there's 36 other countries that are actually healthier, that people live longer and healthier than we do here in the United States. Well, there's no excuse for that. I want to explain to you today how that can happen. And the reason is there are actually 3 forms of healthcare. The first would be crisis care. And we do a wonderful job of that here in the United States. And that is if you're hit by a bus, you fall off a building, you're shot, stabbed, you have a heart attack, the things that need crisis intervention, we are spectacular at here in the United States. Beyond crisis care, there is health care. And these are things that promote health and need the assistance of a professional. Things like dentistry, things like chiropractic care, things like maybe massage and physical therapy that are promoting health and wellness, need the help of a professional, but it's not crisis intervention. The third level of healthcare is self-care. So we have crisis care, health care, and self-care. Self-care is eating right, exercising, making sure you get enough sleep and good water and habits you have, whether you smoke or not, all these different things. So America, again, we do a wonderful job of crisis care. Beyond that, our healthcare system is terrible. We don't do a good job as a nation with self-care. We don't do a good job with healthcare. And that's where chiropractic fits in and helps improve the lives of so many people. Chiropractic fills that void of healthcare and self-care and the education and the knowledge that needs to happen. Yeah, we all want to eat right. Well, what does that mean? I need somebody to tell me that. We all want to exercise properly. We all want to have a healthy spine and nervous system so that we can avoid arthritis and immobility when we age. What does that mean? Well, chiropractors know that. Chiropractors are trained and go through an education process about healthcare and self-care. And we leave the crisis care to the medical doctors and the surgeons and the people who do crisis care. So if you want to avoid crisis care and not be the 37th least healthy country in the nation, then you need to increase the level of healthcare and self-care, which is why everybody should have a family chiropractor.